We'll start by discussing the nurse-client relationship by discussing the scope of the nurse-client relationship. And the nurses use a wide range of effective communication strategies and interpersonal skills to appropriately establish, maintain, re-establish, and also terminate the nurse-client relationship. The nurse-client relationship exists during the period when the nurse interacts with the clients, sick or well, to promote or restore their health, help them to cope with their illness, or assist them to die with dignity. Communicating therapeutically, listening empathetically, sharing information, and providing client education are among the most basic processes that occur in the context of nurse-client relationship. Prior to interacting with clients, the nurse should practice self-awareness. But what is this? So, self-awareness can be defined as the process of the nurse-client relationship requires the nurse to respond to the client's needs. According to the National Council of State Boards of Nursing, there are 4 categories that patient needs fall within: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and psychologic integrity. These content areas are consistently applied within nursing practice, regardless of the stage in the client's lifespan or the setting for the healthcare delivery. Now, as it states in the textbook, to meet the client needs, nurses perform 4 basic roles: the role of caregiver, of educator, of collaborator, and delegator. A nurse is a caregiver for patients and helps to manage physical needs, prevent illness, and treat health conditions. To do this, they need to observe and monitor the patient, recording any relevant information to aid in treatment decision-making. Throughout the treatment process, the nurse follows the progress of the patient and acts accordingly with the patient's best interest in mind. The care provided by a nurse extends beyond the administration of medication and other therapies, and they are responsible for the holistic care of patients, which encompasses the psychosocial, developmental, cultural, and spiritual needs of the individual. Nurses are also responsible for ensuring that patients are able to understand their health, illnesses, medications, and treatments to the best of their ability. This is of essence when patients are discharged from hospital and will need to take control of their own treatments. A nurse should take the time to explain to the patient and their family or caregiver what to do and what to expect when they leave the hospital or medical clinic. They should also make sure that the patient feels supported and knows where to seek additional information if needed, and this is a crucial element. To provide proper care and improve patient outcomes, today's nurses must collaborate effectively with members of the healthcare team from other disciplines. And that means working together as a team and sometimes being the team leader. To do that, they must understand each member's education, scope of practice, and areas of expertise. There will be 5 rights described in the nursing delegation process, and those are the right person, the right task, the right circumstances, the right directions and communication, and the right supervision and evaluation. In other words, the nurse must know when tasks are appropriate for particular healthcare providers. It will be unsafe to delegate a task to someone who does not have the knowledge or expertise to perform it correctly. Once a task has been assigned, it is still the delegator's responsibility to check that the task has been performed and to determine the resulting outcomes. And I'll give an example. If a nurse asks a nursing assistant to change a client's position, the nurse must verify that the assistant has completed the job and obtain other patient pertinent information such as the condition of the client's skin. If the delegated task is not performed or is performed incorrectly, the nurse is held accountable for this inadequate client care. Question number 1. What is the primary function of the nurse in the role of the educator? A. Giving advice. B. Assigning tasks. C. Providing information. Or D. Working with others. The correct answer is C, providing information. As educators, nurses are resources of information and empower clients to become involved. An educator is one who provides information. Nurses offer health teaching that is pertinent to each client's needs and knowledge base. We'll discuss now the phases of nurse-client relationship. The introductory phase starts when the nurse and the client get acquainted and the client identifies one or more health problems for which he or she is seeking care. Both the nurse and the client bring preconceived ideas about the other to the initial interaction, and these assumptions eventually are confirmed or dismissed. Initial contact may begin with an exchange of names and a handshake if appropriate. Before calling a person by his or her first name, the nurse should obtain permission or wait to be invited to use a more familiar form of address, which in some cultures is reserved for family and close friends. The nurse demonstrates courtesy, active listening, empathy, competence, and appropriate communication skills to convey that he or she values the client. Nurses demonstrate partnership and advocacy in the client's healthcare by treating each client as a unique person, by respecting the client's feelings, by striving to provide and promote the client's physical, emotional, social, and spiritual well-being, by encouraging the client to participate in problem-solving and decision-making related to their healthcare, by acknowledging and expecting that the client has the potential for change, by communicating in terms and language that the client understands, by using the nursing process to individualize the client's care, by involving those persons to whom the client turns for support, such as family and friends, when providing care if the client consents, and by implementing healthcare techniques that are compatible with the client's value system and cultural heritage. The working phase involves mutually planning the client's care and putting the plan into action. Both the nurse and the client participate, each shares in performing those tasks that will lead to the desired outcomes identified by the client. During the working phase, attending to a client's personal dietary preferences demonstrates a respect for the unique characteristics of each person, which enhances the nurse-client relationship. The nurse supports the client's independence by allowing the client to pace his or her own care, even when this requires more time. Doing too much for the client is as harmful as doing too little. Allowing independence in self-care and decision-making promotes self-esteem and dignity. So now talking about the working phase. So this represents the middle phase of the relationship, is where nursing interventions frequently will take place. Problems and issues will be identified and plans will be described in order to address all those problems and issues. And as well, the plans will be put into action. Positive changes may alternate with resistance and or a lack of change on the patient side. It is important for the nurse to validate thoughts, feelings, and behaviors. The nurse assists the client to explore thoughts. For example, views of self, views of others, of the environment, and also thoughts on problem solving. The nurse will assist the client in exploring their feelings, which can be grief or anger, mistrust or sadness. Exploring behaviors as promiscuity or aggression, withdrawal or hyperactivity. The content to be explored is chosen by the client, although the nurse will facilitate the process. The nurse will continue his or her assessment throughout all phases of the relationship. New problems and needs may emerge as the nurse-client relationship develops and as earlier identified issues are addressed. The nurse advocates for the client to ensure that the client's perspectives and priorities are reflected in the plan of care. The terminating phase will be the last one and occurs when the nurse and the client will mutually agree that the client's immediate health problems have improved and the nurse's services are no longer necessary. Regression, evidenced by increased resilience or on increased reliance on nursing assistants, or the reemergence of physical symptoms may indicate an underlying fear of having to assume independent responsibility for self-care now. Initially, the nurse must ensure that the client is not developing health-related complications. Therefore, once this is established, a compassionate and caring attitude will help and facilitate the client's transition to independent living or transfer to other healthcare services. Well, we're talking about communication, and I think you are all familiar with the two types of communication by now, verbal and nonverbal. So we will be moving along to the next slide. Again, probably you are familiar by now with the content of this slide. Keep in mind that in general, the nurse should spend more time listening to the patient than really speaking. I will refer you back now to your textbook to page 75, and you will find over there two tables. And those will summarize things to do when communicating with clients and what not to do. I would like you to be sure to make sure that you will familiarize yourself with both of those tables, while remember that there will be NCLEX questions asking for what will be your best response, what is expected from a nurse to be the best response to different situations. We'll discuss now a little bit about the nonverbal communication, and this will represent the exchange of information without using words. It is what is not said. Nonverbal communication consists of components such as kinesics, paralanguage, proxemics, touch, and silence. Kinesics refers to body language, or those collective nonverbal techniques that include the facial expressions and posture, gestures, and body movements. Rolling one's eyes is generally will be not well received as an example. Leaning forward, on the other hand, will demonstrate interest. Paralanguage, what will be that? So refers to some vocal sounds, which are not actually words, that will communicate a message. Some examples include drawing in a deep breath to indicate surprise, or clucking the tongue to show disappointment, and whistling to get someone's attention. All those are considered paralanguage. Crying, laughing, and moaning are additional forms of paralanguage. Vocal inflections, volume, pitch, and rate of speech add yet another dimension to communication. Proxemics refers to the use of space when communicating. In general, there are 4 proxemic zones that are very common when Americans communicate. The zones include intimate space within 6 inches, personal space between 6 inches to 4 feet, social space between 4 feet and 12 feet, and public space more than 12 feet. Most Americans feel comfortable when strangers are 2 to 3 feet away, a distance that is often compromised within a nurse-client relationship. Determining the circumference of a person's comfort zone, the area that, when intruded upon, does not create anxiety, is very important, because physical closeness is very common during nursing care. Approaches that relieve a client's anxiety about being too close will include explaining beforehand how a nursing procedure will be performed and ensuring that the client is properly draped. Affective touch is used to demonstrate concern or affection. Its intention is to communicate caring and support. Most people respond positively to being touched. However, a nurse should use affective touching cautiously, because there is a great deal of affective touch therapeutically when there is a great variation in responses among individuals. In general, the nurses will use affective touch in a therapeutical way when a client is lonesome, uncomfortable, near death, insecure, or frightened. Whenever the client is disoriented, disfigured, semi-conscious or comatose, visually impaired, or has any kind of sensory deprivation. In addition to that, silence. Silence is the art of remaining quiet. One of its therapeutic uses is to encourage a client's verbal communication. Other therapeutic uses include providing a personal presence and the brief period during which clients can process information or respond to a question. There is a scant evidence to support the use of touch with an older adult. Therefore, touch should be used purposefully to reinforce verbal message or in a manner that is culturally appropriate to convey concern or support. However, older adults may perceive touch as culturally inappropriate, offensive, or threatening. Frailty or vulnerability may also have an impact on the client's perception of touch. Therefore, nursing judgment must be used in each situation. Question number 2. A nurse tells a client, "Why won't you use your walker? Are you wanting to fall and break your hip?" This is an example of which of the following barriers to communication. A. Using comments that give advice. B. Using belittling language. C. Using leading questions. Or D. Using probing questions. The correct answer is B. Using belittling language. Using belittling and judgmental comments tend to impose the nurse's standards on the client. In this case, the nurse judges the patient as being lazy, and the nurse's apparent hostility could end effective communication. We'll discuss now the communication with special populations. Some clients, such as those who are verbally impaired or deaf, or those who have limited knowledge of English, and some of them have none at all, have special communication needs that must be met to ensure client safety. According to the Joint Commission published in 2010, caregivers must identify if the client has a sensory or communication need. The providers must identify and address communication needs during assessments, treatments, discharge and transfer, and end-of-life care. They need to monitor changes in the client's communication status and anticipate the communication needs of the clients who are expected to develop communication impairments from scheduled treatments or procedures. Consequently, nurses and other healthcare providers must find ways to help these clients effectively communicate their health problems and needs, give informed consent, and understand teaching about health practices that will have an impact on their recovery or health maintenance. Now, regardless of what type of barrier we may face, the Joint Commission is adamant that healthcare providers need to facilitate the communication with all clients by requiring the following. 1. The agency needs to develop a system to provide auxiliary aids and services to address the communication needs of clients with hearing, visual, or speech impairment, or in some cases, literacy needs. A second requirement is to provide language interpreting and translation services for clients who do not speak English or who have limited English proficiency. Now, why do you think this is of such a big importance for the Joint Commission? Well, research has shown that health disparities due to communication problems in healthcare are very important. The best form of communication with what is called an LEP, or a limited English proficiency client, is by using a certified interpreter, a person who is paid and provided by the healthcare agency to convert spoken or sign language between a healthcare provider and a non-English speaking client into English. The certified interpreter may be present on site or available by webcam. In the absence of a certified interpreter, telephonic interpreting over the phone translation can be an alternative. AT&T USA Direct In-Language Service provides translator in 140 languages whenever and wherever they are needed. The nurse performs a learner assessment to determine the various components of the client's learning status. Besides determining the style of learning a client prefers, the nurse assesses as well the client's learning style, age, and developmental level. Learning needs, learning capacity, motivation for learning, and learning readiness are also evaluated in the first stage. So nurses and all those who provide instruction must be aware of the basic learning characteristics of different age categories: children, adults, older adults learners, and those learners who are developmentally compromised. Currently, there are three major categories. We classify as pedagogy, the science of teaching children or those with cognitive abilities comparable to children, although it often refers to the teaching of all individuals. Andragogy is the science of teaching adult learners, while gerogogy is the science of teaching older adults. Client education begins with an assessment of learning needs. Learning needs are the skills and concepts that the client and family must acquire to restore, maintain, or promote health. For example, the client with diabetes needs to learn to self-administer insulin, which is a skill. And also, they need to learn how diabetes affects their circulation, let's say, which is a concept. Identifying the important skills and concepts that the client must learn and then assessing what the client already knows helps in establishing goals and help in tailoring the teaching plan to the specific individual, as well as establishing how do we evaluate the outcomes. The learning capacity refers to a person's intellectual ability to understand, remember, and apply new information. Illiteracy, sensory deficits, and the shortened attention span require special adaptations when implementing the client teaching. LEP clients may require translation of written information in order to understand and process information and instructions that enable them to make appropriate health decisions. Learning readiness pertains to the optimal time for learning. Ideally, it occurs when the client is in a state of physical and psychological well-being. For example, a client who is in pain, uncomfortably warm or cold, anxious or depressed, is not in the best condition for learning anything. In these situations, it is best to restore comfort first and then attend to teach any new elements. Question number 3. Which of the following will be the most favorable intervention for developing a teaching plan for adult clients? And the options are A. Use long, complex sentences. B. Implement the teaching plan gradually. C. Avoid relating new information to prior learning. Or D. Arrange content within a short period of time. Correct answer is B. Implement the teaching plan gradually. And the rationale is developing a plan and implementing it gradually and sequentially avoids overwhelming the client with new information or new skills. Informal teaching is unplanned. It occurs spontaneously, usually at the client's bedside or while caring for the client at home. Formal teaching requires a plan to avoid being haphazard. A teaching plan is the organized arrangement of a content in a specific time frame. It facilitates reaching goals, provides essential information, and ensures the client's comprehension before he or she assumes responsibilities for self-care. Developing a plan and implementing it gradually and sequentially avoids overwhelming the client with new information or learning skills that are difficult to perform. An effective teaching will be evaluated by assessing the learner's comprehension. To determine if the information was understood correctly, the caregiver can use one or a combination of the following techniques. One technique is the repeat back of the information. Can the client reproduce the information that was told to him or her? A second technique will be the teach back. Are they able to teach someone the same technique, the same skill, the same concept? And the third one will be to show back. It's very useful, especially for showing back is especially useful when we are teaching skills. So, in other words, repeat back involves having the client restate or paraphrase the points that were taught. The teach back will encourage the client to explain the essential information to validate comprehension of the instruction, while the show back will incorporate the satisfactory demonstration of the skills to a person who either taught the client or has similar expertise in the skill.